Some things you should know about mom-med pregnancy tests. When do I start taking pregnancy tests? You can typically start taking pregnancy tests 8 to 10 days past ovulation. This test can be used 5 days before your missed period, 4 days before you expect your period. So start testing 8 to 10 days past ovulation every other day until you get a positive or your period. Do I dip the strip into the urine or directly test with the urine stream? It would be best if you use a small container to collect the urine and dip the test strip into it for 5 seconds. If you directly pee on it, your urine may splash in the wrong places and cause the result to be invalid. Mom-Med actually offers plenty of these urine cups, free urine cups for all the tests, so you can discard them after each use. And remember, it's best to test with your first morning urine as it does contain the most HCG. When do you read the results? It's best to read the results between 5 to 7 minutes. Tests should be read once the paper background is white and no longer pink, and that's at the 7 minutes mark. It is best to read the test between 5 and 7 minutes to avoid confusion. Reading it after 10 minutes, by the way, is invalid. How do I read the test results? If there is only the control line appearing, you may not be pregnant, or your HCG levels may not be high enough to be detected, or you may have calculated your period incorrectly, so test again on the day of your expected period. If your period is delayed, please check again 3 days later. If your test results are still not pregnant and your period is late, see your doctor. If there is a clear test line, see your doctor who can advise you on your next steps. It is possible to get a positive result and later find out that you're no longer pregnant. It may be possible that you experienced an early loss. Sadly, this is not uncommon. About 1/4 of pregnancies will end up in early pregnancy loss. Fortunately, though, most women can go on to have a healthy pregnancy afterwards. If there is a faintly colored test line, it usually means that implantation has occurred and you're in the early stages of pregnancy. Levels of HCG in your body will increase over the course of your pregnancy, but you'll need to test again a few days or weeks later just to see that if that line has become thicker and darker. And that means your pregnancy is progressing. If you have any more questions or concerns, make sure you reach out to us. We're more than happy to help you out.